Pain Part 2, taking control. So now that we understand a little bit of what's going on other than just pain equaling injury or damage, and some of the other pieces that we can influence, we can start to look how we can influence them and how we can take control. So I've kind of put it into two categories here. There's definitely more categories than this, but I just wanted to stick with two that perhaps get talked about at least amongst the health professional side of things, but patients might not be overly aware of. But also, when we do talk about these things as clinicians, I think that the mark can get missed a little bit, okay, or not quite fully understood. I'm not saying that I'm perfect at them either. It's just that there's a couple of downsides and upsides that we may want to consider. So the first is what's called the Therapeutic Alliance. So this is a fancy term to basically say how well you get on with your health practitioner, or how you feel listened to and understood, and how much help they can provide you. Now, so we can think of this as rapport or a partnership, because at the end of the day, it needs to be a partnership where you and the health practitioner work together, because it's your body and you're driving it, and you're also the one who's having the pain experience, right? What I wanted to highlight is this here. So this comes from a study done in 2012 by Lambert et al. I should have put the reference there, but I didn't. But basically what they showed is that the relationship between you and your clinician, now this could be your GP, this could be your physio, your chiro, your exercise physiologist, whoever, has 2 times more effectiveness than the actual technique used. Okay, so I, as the physio, could do a technique to your back to help your back pain, and I've got everything right. Let's say I got the diagnosis right, I got the technique right, I performed it competently and well, but if you don't feel validated, listened to, and understood, the relief you get from that technique will be half as effective as if we actually have a really good relationship. The flip side of that is, obviously the dark side of that is, I could be a really good salesperson and give you a lot of understanding and rapport, and you feel well connected, and do a treatment modality that's low value or not overly effective or not particularly evidence-based, and this happens a lot, and you become then addicted's not the right term, but you become reliant on what I do to you, and then you get stuck in a cycle as well. So you feel like what I'm doing is having a greater effect than what it actually is. So this